Hello everybody, this is Fu from Veterinary College of Southwest University. The year 2021 is coming. I'd like to send my best wishes for the new year to all comrades in this group. This group inviting veterinary doctors, paraprofessionals, animal farmers joining together. We safeguard animal health so as to promote the health of we human beings. We have been discussing a lot of cases since the start of this group 3 months ago. I would like to take this chance to say a few points about diagnosis, especially for diagnosis of infectious disease, which compose two parts. One is clinical diagnosis, the other laboratory diagnosis. Clinical diagnosis includes epidemiological property, clinical symptomatic property, and anatomical property. So clinically, we have three diagnostic methods. Epidemiological property are concerned with aging days of onset of disease, onset of season, onset of animal species. Some farmer told me that, Mr. Fu, my border chicken weighed 2 kilos already. I wonder, what does this mean? Is this 35 days in age or 30 days in age? If your boiler do not glue, maybe it can be 40 days in age. We don't talk about weight. We talk age in days. We usually say calf in 10 days old, lamb in 3 months old. However, someone consulted something in this group. They only say this is calf. They didn't provide us age in days. So it is difficult for us to make good judgment because age in days is very important epidemiological character. For pigs, cattle, sheep, birds, there are some diseases occur in specific aging days only. For example, bird IBD most occur in 20 to 40 days in age. It hardly happens in other times. Second is clinical symptoms. You need to give us a precise, accurate description. I remember someone posted a photo. I saw the animal is a sheep, but actually it is a dog. He even gave us full picture of its head. Someone posted a video, but very short. Information is very little. I suggest photo or video should be more and from different angles. Among all these symptomatic indication, I think temperature is most important. Animals do not speak, but you can speak for them. If the animal suffers from fever, what does this mean? This means it gets infectious disease. Only infectious disease cause fever. Other disease, other internal and surgical disease will not cause fever. For example, in this global pandemic, I'm always be aimed by a temperature mirroring gun. People want to make sure I'm free from infectious disease. If there's no such basic symptomatic information, like food intake, spirit, history of disease, how can we make a diagnosis with only a picture? Thirdly, anatomy. Being a veterinary doctor or veterinary practitioner, you need to keep a knife with you always. What is the purpose? To conduct post-mortem. After autopsy, what do you get? You get pathological changes. Then you can tell us, is there edema, is there blooding, is there leukocytes or ulcer? I would like to say that I could not see anything valuable from this picture. At least you should pin out the position of lesion with your scalpel like this. You'd better keep a record of all these sections in a notebook. What is the benefit? Whenever you have time, you can review it, summarize it, and accumulate your experience. If you want to present the case for discussion or ask for help, you need to describe the disease in these 3 sections. The more, the better, so we can give you a better recommendation. Otherwise, how can we do? We cannot say the case is like mycoplasmal pneumonia, and at the same time it was like streptococcal pneumonia. we cannot play a game of guess here. With detailed description, it is easier to get to know infectious pathogen. Only at the time when pathogen is clear can we apply proper medication and get proper treatment results. Then we come to laboratory diagnosis. It is meaningless to argue it is PPR or CCPP if you don't have laboratory evidence. Many different diseases have same symptoms. On the other hand, for certain disease, we usually see no typical sign on the field. Some necessary equipment, for example, microscope, I think is affordable, around $300. What can you do with it? To analyze parasite eggs. So you can tell us it is coccidium or others. You can connect stools and analyze by floating and count. Or you can smear. Coloring agents is available everywhere, around $10 per 200 ml. Then we have colloidal gold. This is a test strip, around $1 per piece. You can use it to verify if there is TB or brucellosis. Although its detection rate is low and sometimes inaccurate, but people believe you because you have done this. Only by this way you can improve yourselves. This is a glimpse of our diagnosis center. This is a clean working table. This is PCR. Lastly, hope we entered a peaceful year for animals and for us. Keep well. Bye-bye.